Good day students, welcome to the next session of Raw online classes. I am Dr. Mitra from the Department of Conservative Dentistry and Endodontics, Sri Balaji Dental College and Hospital, and today my topic of presentation is going to be in detail about the clinical procedure for placement of composite resin restorations. Now let us go into the content of today's class. So we are going to see a brief introduction about what is composite. Then we are going to see in detail the clinical steps in placement of composite, the various tooth preparation designs or the cavity preparation designs for composite. We are going to see the definition of bevels, the different types of bevels, in detail about class 3, class 4, class 5 cavity preparation for composite, what is acid etching, what is bonding, the various incremental layering techniques, the various placement techniques for composite resin restoration, the technique of finishing and polishing of composites, and finally the conclusion. Now let us go into detail. Coming to the introduction. So composite resins, as you all know, it was introduced by Dr. Raaonline in the year 1962. So composite, it can be defined as a solid that has been formed from two or more distinct phases that have been combined to produce properties superior to or intermediate to those of the individual constituents. In the sense, composite resin as such has got all the following components in its composition, which includes the resin matrix, the filler, the coupling agent, the activator initiator system, the inhibitor and the coloring pigment. So all these components have been combined together to form a superior composite material. That's what the definition means. Now we'll see just briefly about the various clinical steps in placement of composite. First one is the oral prophylaxis. So whenever the patient comes to you for a composite resin restoration, the first thing you need to do is oral prophylaxis. So oral prophylaxis is a must to remove the plaque, calculus, materia alba and any organic pellicle layer that is present on the tooth. So once oral prophylaxis is done, on the same day composite resin restoration cannot be done because of the bleeding that is induced from the gingiva and the surrounding soft tissues. So it is recommended to do oral prophylaxis the first day, and the next day the patient can be called for a composite resin restoration. The next step in composite is on the second visit. You have to do the shade selection, then followed by the rubber dam isolation, then the cavity preparation. Once the cavity preparation is completed, you have to etch the particular tooth surface with 37% phosphoric acid for 10 to 15 seconds. Once the etching is completed, you have to rinse it with water for double the time, that is approximately 30 seconds. Then the next step is to dry the prepared cavity or the tooth preparation with a blotting paper or an absorbent paper. You have to dry the etched enamel and dentin. Once that is done, the next step is the application of the bonding agent. So herein we are following the moist bonding concept so that the collagen fibrils are adequately maintained and the interdental collagen is not collapsed. Then once the bonding agent is applied, the next step you have to light cure it. You have to use a visible blue light curing unit. And you have to light cure it you will have to light cure the bonding agent for 20 seconds. So once you light cure the bonding agent for 20 seconds, the next step is the placement of composite in incremental layers. Each layer should not be greater than 2 mm in thickness. So once that is done, you have to cure each increment of composite for 40 seconds. Once that is done, the final finishing and polishing of composite. Again, let us go into detail about each of these individual steps. So let us start with the first step, which is oral prophylaxis. So once that is done, so this one I have already told you. So let us go in detail about the shade selection. So shade selection, so this is a picture where I have shown you the isolation with rubber dam, and this is nothing but a gingival retraction cord which is placed inside the gingival sulcus to control the flow of the gingival cervicular fluid. Supposing you can't isolate the particular cavity with a rubber dam, you can use a retraction cord. Okay, you can use this retraction cord, pack it into the gingival sulcus and you can use it as a means of isolation. So ideally isolation should be done with rubber dam, or sometimes you can use cotton rolls, and this is your gingival retraction cord. So now let us see about shade selection. For shade selecting for composite, the first step before you start the cavity preparation, you have to do the shade matching or the shade selection. So ideally in your regular clinical practice, 2 shade tabs are available. The first one is a Vita Classical Shade Guide, and this is the Vita 3D Master Shade Guide. So you can use both. So ideally Vita 3D Master is recommended. In the Vita Classical Shade Guide, as you can see, the shade tabs are arranged from A1 to D4. Okay. So, when it indicates a value of 4, it is supposed to be a dark shade. When it indicates a value of 1, it is supposed to be a light shade. So, depending upon this, you can just do the shade selection. Shade selection, it should be done like this. You take the particular shade tab and place it inside the in contact with the palatal surface of the particular tooth to be restored. Ask the patient to slightly open the mouth and you place a particular shade tab on the tooth which you want to restore. Slightly place it intraorally in contact with the tooth you want to restore. So, when you look at it, you can match the shade. So, maximum you should not do it more than 5 seconds. If you do it more than 5 seconds, your eyes, rods and cones will be strained and you tend to select a darker shade. So, always you do have to do the shade matching within 5 seconds. So, this is about the Vita classical shade guide. So, whichever the shade tab is matching with the particular patient's tooth, you can select it. Same way, the different shades are available in the composite kit. So, which shade corresponds to the particular color of the shade tab that you have selected, you can select it for the particular use. Now, this is the Vita 3D master in which the shade tabs are arranged according to hue, value and chroma. So, what is this hue, what is this value, what is this chroma? Hue is the particular color of the object, in the sense it is a particular color of the tooth, whereas chroma is the degree of saturation of a particular hue, how pale or how dark the particular shade is. Then coming to value, value is nothing but the degree of lightness or darkness of a particular color. So, if you see here in this particular shade tabs, it is arranged according to value. So, this is, so you can see numbers 1, 2, 3, 4 and 5 here. So, number 1 indicates value 1, number 2 indicates value 2, number 3 indicates value 3, number 4 indicates value 4 and number 5 indicates value 5. So, value 1 is the lightest shade and value 5 is corresponds to the darker shades. So, like this it is arranged according to value. According to chroma, if you can see, it is arranged, see from the top. So, each value has got the shades arranged according to particular chroma and particular darkness. Okay. So, if you see here, so you see the light shades are on top and the darker shades are given below. So, this is one group, one value group. This is the second value group, that is why it is numbered 1, 2, 3 and 4. Okay. So, this is first value group, second value group, third one, fourth one and fifth one. So, if you see each one has got, actually this is a middle tab, middle shade tab. So, you have 3 light shades on top and 3 dark shades below. Same way, this is the middle tab and you have 3 light shades above and 3 dark shades below. Same way, this is the middle tab, 3 light shades above and 3 dark shades below. So, depending upon this, you select the particular tooth. So, what does this L, M, R indicate? So, this L means the shade is more of a yellow and R stands for the shade is more of a red. So, when the particular patient's tooth is more towards a yellow shade, you select from the shades which are on the right side of the shade tab. And when you are selecting a patient's tooth is more towards a red color, those on the left side of the shade tab you will